Good day, everyone! Today's topic is about critical issues facing radiology. First, we're going to discuss about what is radiology.
Radiology is now the key diagnostic tool for many diseases and has an important role in monitoring treatment and predicting diseases. Now, let's discuss the critical issues facing radiology.
The landscape of healthcare industry is poised for dramatic change in 2015 and the years ahead, and radiologists need to be ready to adapt if they're going to thrive. This was the overarching message from the plenary session Critical Issues Facing the Practice of Radiology in 2015 and beyond. At RSNA 2014, presented by Bibb Allen Jr. MD.
The largest issue looming on the horizon is a transition for the fee-for-service to a value-based payment model. Fee-for-service, or the FFS, is a payment model where services are bundled and paid for separately. In healthcare, it gives an incentive for physicians to provide more treatments because payments is dependent on the quantity of care rather than quality of care. Value-based payment, or VPB, is a concept by which purchasers of a healthcare, like governments, employers, and consumers, and payers, public or private, hold the healthcare delivery system at large accountable for both quality and cost of care.
Today I'm going to walk through the difference between fee-for-service and value-based care, and why it's so key to keeping all of us healthy. Now, let's talk about why this is important to you. Costs are continuing to rise, and the responsibility is shifting onto the employees. And as you can see, we are not leading the world in outcomes. This is a very big problem, with lots of different factors affecting it. Today we're going to talk about one key feature. How do we reward the system? How do we pay for things? Today's model is fairly simple. It's what we call fee-for-service. You pay a fee every time you receive an aspect of care. This type of reimbursement model ends up rewarding one thing: more volume. When we're incenting this type of behavior, what do you think ends up happening? So, who gets the short stick? Unfortunately, it is the two groups that pay for the service: the patients and employees, and the employers. Now let's talk through the emerging reimbursement model, value-based care. This is when payment for delivery of care is tied to the actual quality and outcomes of that care. Here is an example of a bundled surgery on your shoulder. All of the following is included on one price for the patient, the employer, and those that are taking care of them. Why should we change to this model? First off, this requires coordinated healthcare, better for the patient. Second off, they get more information, making them more engaged. And finally, the price is much more transparent. Everybody knows going in what the price is going to be. Here are just a few of the many examples of this being successful. Now you're probably asking, what has this got to do with me? If we want to make any progress, we have to change the one thing holding us back, our reward system. Let's reward value. How can you help? You could ask your HR team, do we have value-based healthcare options? If you are an employer, you can ask one simple question: how much of our spend last year was through value-based healthcare? If you're really committed to making this change, you can give us a call. We're here to help.
Allen termed the shift a revalidation of current inputs as the Center of Medicare and Medicaid Services work through the current procedure terminology codes to determine what codes can be eliminated or bundled together. According to him, the key is adapting to healthcare reform which center on 4 ideas. First, better health for the population. Second, the better care for individuals. Third, lower cost through improvements. And lastly, more patient-centric focus.
To help radiologists ensure that they are taking the best course of action, the ACR released its own appropriateness criteria for clinical decision support, or the CDS. The document contains evidence-based guidelines for radiological options in response to various conditions and scenarios, along with an appropriateness rating for each option. The appropriateness criteria are regularly updated but are still not widely used at the point of care according to McGinty. So how should they manage the population?
With an increased focus on patient-centered care and the emphasis on decreasing volume, the best way to satisfy these dual objectives is to be more mindful of population health management. This means keeping a population as healthy as possible while minimizing the need for intervention, from the hospital visits to imaging exams.
As the new measures are implemented going forward, radiologists have the opportunity to help each other improve and adapt by coordinating a strong quality management framework.
The idea is to get everyone on the same page in terms of quality, safety, and performance improvements of efforts.
Above all else, being proactive in addressing these critical issues is the key for radiologists to survive and thrive in the changing landscapes. And that will be all. Thank you.